So each and every Monday here on KPRC 2 Plus, we're starting something new. It's called To Your Health. We'll be talking with the Houston Health Department about public health topics that impact all of us, really. Today, we're speaking with Dr. David Purse, Chief Medical Officer for the City of Houston. Dr. Purse, good morning. How are you?
Good morning. Thanks for having me.
Thanks for spending some time with us. We do appreciate it. Sir, one of our topics today, we're talking about this triple-demic we've heard about since the fall. You guys have been warning about this: COVID, the flu, and RSV. Where do things stand right now, Doctor?
So right now, things are looking much better. So let's keep our fingers crossed that it continues this way. But we have this last wave of COVID seems to be tearing down and getting lesser. And of course, everybody remembers that back in November, we had a pretty significant flu wave and RSV. So those are down as well. So this is really good news. The only thing I'm worried about is that we are still kind of right in the middle of the viral season. So could things ramp up again? Absolutely. But right now, things are looking great.
Okay, so good progress, maybe halfway or so through the season, however that looks like. Doctor, what about hospital capacity, given, let's say, the tide does turn a different direction? How are we doing right now?
Yeah, so that is a real challenge for the hospital administrators, because not only do they have to worry about more patients coming in with viral illnesses, but remember, their staff are also susceptible to becoming infected with these same viruses in the community. So then they have another manpower problem. And in addition, as everybody knows, across the nation, we've got a serious nursing shortage right now. So this is one of the reasons we like using our wastewater, because it gives a pretty reliable predictor of what's going to happen. And that allows the hospitals to kind of manage their workflows, manage their, the number of elective admissions, for example, that they're going to be bringing into the hospitals. They can regulate that so that to create capacity if they anticipate a need. So right now, with all these viral illnesses going down, the hospitals are actually in a good position to take care of folks who have whatever the illness is. But they're keeping a close eye on things, and especially that wastewater gives us about a 2-week heads up as to what's about to happen.
No kidding. That's good. I mean, obviously you want to take the heads up where you can get it. Doctor, what can Texans do? What can we all do to protect ourselves from any one of the three with the triple-demic this winter?
Yeah, so the thing is that these viruses, we just went through this whole COVID thing, and I think most Texans have become pretty well educated on how viruses spread. And some viruses spread easier than others, but they tend to spread in a respiratory way. So for those people who are greatest at risk and what are really concerned, they probably need to consider continuing to wear masks. Everybody should consider getting vaccinated, whether it be for the influenza or COVID. And remember, let's be realistic about vaccinations. They are not necessarily going to keep you from getting sick. They do, for many people, they do keep you from getting sick. But of course, if they kept you from getting sick, you don't even know that, right? They don't know that you didn't get sick from an exposure that you had. You only know that when you did get sick. And so what we're also seeing is that for the folks who are vaccinated who still get sick, they're getting far less sick than they would have compared to the folks who didn't get vaccinated. That goes for COVID, that goes for influenza as well. And we're working on the pharmaceutical industry is working on an RSV vaccine for adults. We don't have that yet, but you do have vaccine that is very well matched this year for influenza. And of course, we've got the COVID vaccines available as well to protect you.
Doctor, for years, growing up, I think the only thing we worried about was maybe cold or flu. It was cold and flu season. Do you think this triple-demic is something that we're going to just have to kind of get used to during the winter months from here on out?
Yeah, I'm afraid this is going to be the case, because COVID's not going to go away, unfortunately. Hopefully, it will just become a seasonal illness that has minimal, death that it would cause, and minimal, people being out of work. But I'm afraid it's not going to go away. So, yeah, I kind of think that we're going to be dealing with this sort of thing for decades now.
All right. Well, I guess we better get used to how to handle it. Dr. David Purse, Chief Medical Officer for the City of Houston. Thank you so much, Doc, for joining us on this very first of our weekly segments. Thank you.